Hello everyone, so I guess I'm live right now. Can you all please confirm if the audio is clear? Do message in the chat box so that I get to know if my audio is clear to you all. Okay, so finally, after around 8 to 9 months of preparation, we are finally done with NEET MDS 2023, right? I know you all are in a relaxing mode right now. After so many months of slogging, you all want to relax and not discuss the paper. But to be of help for the coming batch, let's just quickly analyze the exam paper. So I want your help as well so that we get to know how the paper went. Okay. Right. So how are you all feeling right now after the exam? What feeling do you all have? So I guess this is the feeling for most of y'all right now. Correct? Don't worry, even if the paper went good for you, the paper went bad for you, it was average, do not worry. Okay, this is not life, correct? But don't think too much about this. I know you have worked so hard for this day, right? But don't think so much about it until the day of your results and all that. It'll come when it has to come. Okay, now sit and relax. Okay, you need that break, right? Now let's quickly analyze how the paper went. Okay, so we had done a small poll on Instagram page. So based upon the poll, we had done the poll to assess the difficulty level of today's paper. So the majority of you all have given a rating of average to today's paper. So I assume, based upon my students review as well, I assume that the paper was medium, not too easy, okay, and not very complicated also, correct? Right, so let's split the paper up. Let's discuss in parts. Okay, so again, can you all please confirm in the chat box if you can hear me? Right. So first, talking about the difficulty level, right? So like the poll said, and like many of my students said, the assessment that I have come across for the difficulty level is that the paper was medium, correct? Not too easy or not too difficult, correct? Now the parameters might differ. Not everybody who feel the paper is easy, some might feel the paper is difficult. The parameters differ based upon students, but all in all, overall the paper sounded medium. Okay, right, that is about the difficulty level. Okay, now when you compare it with the NEET MDS 2022 paper, any idea how the comparison is? So based upon my assessment, last time the paper for the NEET MDS 2022, the paper seemed very direct. Okay, there were so many direct questions, so many image based questions. So as soon as the exam was done, students came and said the paper was very easy. Okay, it was all known questions. But there was a small problem in last year's exam. The questions were very direct, but the options were very confusing. As in, they had very similar options wherein it was difficult to mark the right one. Okay, so that was about the NEET MDS 2022. But compared to last year, I feel this time the paper was a little bit more tricky. Okay, when I say tricky, the paper was more clinical based. There were image based questions and all, but it was more of clinical questions and lengthy questions wherein you had to apply. Correct? Right, that is about the comparison. Now moving ahead, the next thing that we need to discuss is about the paper. So we have part A and part B. Correct? So Rifa is telling about the image based questions. Correct. Image based questions were lesser. Correct. Last time I know there were so many image based questions. So that is all a scoring factor. Correct. This time the image based questions were less. Right. Now when we talk about part A and part B, talking about part A, so we know part A is mainly your clinical part, right? The medical aspect. Now how was part A? Comparison of part A and part B, which was easier? So the difficulty level of part A was more. Okay, so how was it difficult? Because obviously most of the exams that we have, most of the NEET MDS exam, the part A comparatively is slightly more tougher than the part B. Part B is all dental, right? So most of the questions are direct. But from part A, this time I think there were lengthy questions. Correct? So the questions were very lengthy, right? Now when I say lengthy questions, it was time consuming, and also there were questions wherein there were so many parameters. So when you see a long question, it is difficult for you all to come to one conclusion. Correct? So you have to apply your intelligence into that question. So it takes your time as well. Right. Rifa, the part B was easier, right? The questions were very lengthy in part A. Correct? So that is about part A and part B. The next thing that we can assess, so part B, like we said, they were all dental questions and more of direct questions. Rifa, can you tell me if there were repeats or questions directly from Dental Pulse? Yes. So yes. Okay. So very few. Even otherwise, when we talk about a question paper, it is always the difficult ones that comes across in our mind post the exam, right? So there would be repeats. There has to be repeats, or there has to be direct. If not repeats, there has to be direct questions. Correct? So that would be mostly in part B. Correct. Riga-Fede syndrome, AHI index, those are all expected ones, right? So, we'll have a session on the recall as well, wherein we'll try to recall the questions given for the exams. Okay, so repeats they were, correct? Next thing that we need to know is about the image-based questions. So, image-based, like you already mentioned, the image-based questions were lesser comparatively. Approximately, could you tell me approximately and on an average how many image based questions would have come up for the exam? Approx, from what I got to know, approximately 20 to 30 or lesser. Yeah. Then about the case based questions. So case based questions, again in part A there were too many case based questions, wherein most of them were from medicine. Okay, so y'all feel the image based questions were lesser than this, right? Okay, okay, fine. So case based, yeah. So there were so many questions from medicine aspect wherein you had to apply, correct? And questions that, and even the image based questions, it was not the routine images that were asked, correct? So routinely you have a set of pattern, the appliances or instruments. So those were not the images that came this time, right? The images were, I think, totally different. So I think we have to change our strategy of reading from just basic dental pulse and stuff. I think we have to move more into textbook reading and images from standard textbooks, I guess, right? So yeah, no old images, right? So it was all new ones, correct? Now next thing is about the subject weightage. So when we split it subject wise, uh, in one shot, what do you feel? Did they follow the subject weightage that they give in the site? That is, NB says that the subject weightage for each subject is almost equal. Like they say 14 each for all the subjects and 15 marks for general surgery and general medicine. That's a weightage that they give. So do you all feel that was followed, or no? Okay. Do you can you just tell me which subject on an average or overall, when you see, which subject had more questions? Medicine, I think, had more questions, or which is that subject that you feel had? Yeah, general medicine, more than expected, right? Any other subject in from the dental part? What do you feel? How is the weightage? It was. I know it's difficult to recollect at this point, but right. The next thing that we need to know about is about the time management. So since y'all mentioned that part A was lengthy, so managing time was difficult, but I assume y'all completed your exam on time, right? Okay. So time management, the it was time consuming because reading lengthy questions again is tricky. So do not come to a conclusion in one reading, right? So it takes time to read those questions. So time management also will have to practice a little more when it comes to our next year examination, correct? So I think that was the overall assessment of today's paper. So in general, if you have to rate the question paper, Rifa, would you agree that the paper was not too difficult? Was it an average paper? Right. Okay. Fine. So yes. I think with that we come to the conclusion of our paper analysis. We'll have a recall session later on, but now for now what you need to do is you need to take a break because you all have been slogging for so long, right? Correct. So what plans now? Waiting for the results, stressing out, or are you all planning to go to Goa or any other places? Take a break. What plans for the coming 1 month? Anuja is asking. Rifa, yeah, definitely. You deserve a break. I know that. Right. Anuja, answer keys usually they do not publish. The answer keys are not published. Even the question paper, you do not get a direct question paper from NBE. The questions usually that we try to recall is from the memory based recall of the students. Okay, so I've tried and collected questions from my students. So let's have a recall session wherein we'll discuss the questions and the possible options and answers. Okay, we do not get the answer keys from NBE. Okay, now we'll have to wait for Dental Pulse of next year to see the proper questions and answer. Even that is memory based questions, recall questions. Okay, right. So y'all sit and relax, have a good time. We'll stop the live for now. Bye bye.